Hello, and welcome to our next episode of Coffee with Kelsey. We're happy to invite you here today to learn more about Adoray Home Health and Hospice and introduce you to some of our team members. Today I'm joined again by our Rehab Clinical Manager, Christa Walz, and she will be telling us a little bit more about our Rehab Program, which she oversees here at Adoray. So October is Physical Therapy Month, so we would like to give you all an opportunity to learn more about the rehab services that we offer here at Adoray. Thank you, Christa, for joining us today.
Thanks for having me, Kelsey.
So to start with, could you just tell us a little bit about the rehab program we have?
Yeah, so here at Adoray, we offer a full spectrum rehabilitation program, and that includes occupational therapy, physical therapy, and speech therapy. Therapy would help individuals resume their daily activities and improve their overall health and well-being. It's for patients who may be unable to get out of their home to go to a clinic for physical therapy or occupational therapy, or for patients who just feel more comfortable and would rather have the therapy in their home. Therapy and therapy assistants work with patients on mobility and lifestyle changes. They monitor symptoms and request interventions to help avoid any unnecessary trips to the emergency room.
So what are some common reasons or diagnoses that a patient would have for coming onto service with us?
Yeah, so as licensed therapists, we can treat patients with a wide variety of diagnoses, and we also can treat patients of all ages. So some examples would be some post-surgical conditions such as a total joint, a total hip replacement, or a total knee replacement, stroke recovery and rehabilitation for after they've returned home from a transitional care stay, Parkinson's disease symptom management, multiple sclerosis. We do treat patients with ALS, after a cardiac event like a heart attack, a trauma such as a fracture, or weakness due to a prolonged hospital stay.
So in our rehab program, we have a few different specialties. I would like to take the opportunity to highlight the different specialties that we offer. So could you begin telling us about physical therapy?
Sure. So with physical therapy, our main focus would be on strengthening, assessing their gait, balance, making sure they're safe in their home, and fall prevention, and making sure that we can return them to their optimal level of function. Occupational therapy, they deal more with someone trying to return them to their usual activities of daily living. So whether that be helping them to improve their ability to dress themselves or cook in the kitchen or to shower. They also deal with patients on a little more on their cognitive issues that they may be happening and help them improve their function at home. Speech therapy, they can assess and treat patients who have swallowing difficulties, post CVA patients who may have some trouble swallowing. They can help with strengthening their swallowing muscles. And then our speech therapists also, they kind of go a little bit deeper into cognitive issues and cognitive retraining. Some special programs that we offer here at Adoray would be the LSVT Big and Loud, and that is a specialized Parkinson's program. What it is it combines with the physical and occupational therapy, big movements, so working on really big exercises, and then our speech therapists would come in and do the loud portion and work on trying to accentuate their speech and making it louder. Parkinson's patients have some really great improvement in their overall mobility after going through the Big and Loud program. So we're really excited that we have therapists trained in both of those. And then another program that we offer is lymphedema. We have therapists that are certified in lymphedema and work on wrapping patients' legs to help with decreasing their lymphedema.
Mm-hmm. So this sounds really great. I'm also wondering if we have a short, simple test for falls that individuals can do at home.
Yes. So I use this test, it's called the 5 times sit to stand test. And you want to take a standard chair and you want to try to do 5 times up and down without using your hands. And if you can do it in less than 15 seconds, that indicates that you're probably at a pretty low risk for falls. But if it takes you longer than 15 seconds, then that would indicate that you do have a higher risk of falls, and it might be time to go and have an evaluation by a therapist to see if there's some things that you can do to help decrease your fall risk. So I'm gonna go ahead and just do a real short demo. So you would just take a standard height chair and you're gonna cross your arms right in front of you here because you can't use your arms. And then you would stand up and sit down 5 times. And like I said, if it takes less than 15 seconds, you are probably at a real minimal, not likely at a fall risk, but if it takes more than 15 seconds, you could be at a high fall risk. So 1, 2, 3, 4, and 5. And what this really does is it focuses on your strength and then your initial standing balance, which can be indicators of falls if you are lacking in those areas.
Thank you so much for joining us today and sharing all of this information with us. It's wonderful to learn more about the programs here at Adoray. If you are looking for more information, please feel free to visit our website at adoray.org to learn more about our rehab program and our other programs that we offer. And we would like to give a really big shout out to all of our physical therapists this month in October as we're celebrating them. Thank you all for joining us on this edition of Coffee with Kelsey.